So looking at the Norma verticalis. So when you view the skull from the top, this is known as Norma verticalis. The Norma verticalis is constituted by four bones. We have two paired bones on the side. These are known as the parietal bones. We have one bone anteriorly. This is known as the frontal bone. And posteriorly, we have a bone that is known as the occipital bone. What are these structures here? These structures, we know these are the sutures that are special joints that are present in the skull bones. When you look here, the two parietal bones are joined together by this suture that is known as the sagittal suture. The parietal bones are joined together to the frontal bone by this suture that is known as the coronal suture. Posteriorly, the two parietal bones are joined together to this bone, that is the occipital bone, by this suture that is known as the lambdoid suture. Now, the point where where this coronal suture and the sagittal suture join together, this point is known as bregma. The point where the sagittal suture and the lambdoid sutures join together, this point is known as the lambda. When you look at this skull from the top, you see that there is a prominence here on the lateral side. This is known as the parietal eminence. Here you see two important parietal eminence. The skull is narrow interiorly as well as posteriorly. So this is the point of maximum diameter of the skull. Okay. Then, so what are the points we saw here? We have the bregma, we have the lambda. Then the point here is known as the vertex. If you look at here, we have an opening here. This is known in the parietal bone. This is known as the parietal foramens. Here, emissary veins pass through it. Now, there is some importance of this prominence, that is the parietal eminence. What is its importance? First of all, this is the maximum transverse diameter of the skull we measure at between these 2 points. This is the point where ossification begins. Okay. Now when we look at the Norma verticalis, there is a difference in a skull of a newborn and a skull of an adult. So here, this point, that is here where I said bregma, in a newborn child, you see that here we have a membrane that is rhomboid in shape. This area, the two sutures, these sutures are not fused with one another, but we have a membrane here. This membrane here is known as the anterior fontanelle. The anterior fontanelle is about 2 into 2 centimeters. This anterior fontanelle fuses at about 18 months of age. Posteriorly, here, where we have a lambda, normally in a newborn child, we have a membrane here that is known as a posterior fontanelle. Now, what is the importance of these membranes here and here? If we have membranes, why do we have membranes here? So the importance of these membranes is that fusion नहीं हुआ है. So what does it do? It helps the bone to slide over one another and helps the baby to pass through the birth canal. That is, it helps in molding of the head. That is known as molding of the head. So बर्थ के दौरान क्या होता है, बिकॉज बाइपराइटल डायमीटर हमारा ये होता है, तो ये स्लाइड करती है बोन्स एक दूसरे के ऊपर और स्कल का डायमीटर थोड़ा चेंज हो जाता है एंड इट हेल्प्स इन पैसेज ऑफ द चाइल्ड थ्रू द बर्थ कैनाल. वन दूसरी चीज़ इसके लिए इम्पॉर्टेंट होती है कि इट हेल्प्स द ब्रेन टू ग्रो. अगर ये कॉम्पैक्ट होगा, पहले ही सारा फ्यूज़ हुआ होगा, तो ब्रेन कैसे ग्रो करेगा. सो ये ब्रेन को ग्रो करने में हेल्प करते हैं fontanelles. सो टू इंपॉर्टेंट फंक्शंस ऑफ दीज fontanelles. फर्स्ट, दैट इट हेल्प्स इन मोल्डिंग ऑफ द हेड, therefore it helps the passage of the head during the birth. Then second important thing is that it helps in the growth of the brain. In clinical practice, you can see whether by looking at this anterior fontanelle, we see that whether अगर ये बल्ज हो रहा होगा यानी ऊपर को निकला होगा, दैट मीन्स इंट्राक्रेनियल प्रेशर ज़्यादा है. अगर ये डिप्रेस्ड होगा, दैट मीन्स बच्चा डिहाइड्रेटेड है. प्लस सम ऑफ द प्रोसीजर्स जो है दैट कैन बी कैरीड आउट बाय दिस मेम्ब्रेनस एरिया. एक और इम्पॉर्टेंट चीज़ होती है कि नॉर्मली जो एंटीरियर फॉन्टेनेल होता है दैट फ्यूजेस एट 18 months ऑफ एज. इफ़ इट फेल्स टू फ्यूज़ एट दैट टाइम, दैट मीन्स बच्चे को नॉर्मली रिकेट्स देखा जाता है. ठीक है. सो दिस फिनिशेस द Norma verticalis. So if somebody asks you about Norma verticalis, you have to know what are the different bones that take part here, what are the different joints you see here, what are the sutures you see here, and what are the points you see here. You should know what is anterior fontanelle and you should know what is posterior fontanelle.